My name is Jordan, and today I am going to demonstrate how to do a chest tube dressing change. So the first thing we're going to do is we note that Jennifer Doe here has no known drug allergies or sensitivities. Date of birth 11/5/1975. We were in doing an assessment on her chest tube and noted that she needed a dressing change, so we're going to get that done right away. So we're gathering up our supplies. I got some clean gloves here. Our cleansing agent, which in this case is just going to be sterile water, some hand wash, skin prep, Q-tip applicators, a container for our cleansing agent, tape, two sets of sterile gloves just in case we need them. I have petroleum gauze, drainage sponge, and gauze sponge. Alright, so we're ready to go in. I also have my biohazard bag there. Hi, Miss Doe. My name is Jordan. I am the student nurse on the floor today. I'm here to do your chest tube dressing change.
Good.
Awesome. All right. I will provide for privacy and wash my hands quick. And can I get a full name and date of birth, Miss Doe?
Jane Doe, 3/1/1968.
Okay, that matches my MAR and wristband. And any allergies, Miss Doe?
None.
No sensitivities to tape, adhesive, anything like that? Cleansing agents?
Not that I know of.
Okay, awesome. So we're going to get started. Wash my hands. I've provided for privacy. I have explained the procedure to our patient. And I'm going to throw on a set of gloves here. Alright, Miss Doe, I'm just going to lift up your gown here. Alright, and have just kind of a look at our site. And I note that there is little to no shadowing. So we are going to anchor our hand on the chest tube to make sure not to dislodge it as we're pulling off. And I'm going to pull the tape back starting from the outside and working my way towards the insertion point. Okay. And as we pull off, we're going to take our dressing and look at the color, the odor, consistency, and amount of any drainage we have on here. And we don't have much, so I will document that, and we will put our dressing in there and removing the petroleum gauze as well, and looking at any drainage that may or may not be on here. All right. Any pain or tenderness, Miss Doe?
Nope, none.
Okay, and I'm going to kind of feel around for some crepitus. Feels kind of like Rice Krispies under the skin. Feeling my way up the chest and around the neck because air does tend to rise. And had we found some crepitus, which in this case we haven't, we would make sure to mark it with a skin marker so that way we could monitor it and make sure it's not getting any worse. So, all right. Site looks good. No redness, no edema, and no drainage. Okay. So, next thing that we are going to do is we are going to take our gloves off. I'm going to wash my hands again. Alright. And we're going to get another set of clean gloves on, and I'm going to get my cleaning solution ready, and we will clean around that site. And checking the expiration on our bottle and making sure it is in fact the sterile water. We'll palm the label, pour approximately 6 inches above our cup. And pulling out our Q-tip applicators, we will drop those in right away. Okay. Miss Doe. Cleaning around the tube. All right, Miss Doe. And now I'm gonna get my skin prep out right away, and I'm gonna wipe around the area that the tape will go. Clearly Miss Doe would not have a sutured wound there that we would put the skin prep on. Okay, garbage with that. And we will remove our gloves while we wait for that to dry. And wash our hands. And we will start to prepare our sterile field. Okay. And right away we will get our sterile gloves prepped. And finessing the gloves. We'll attempt to get them on. You can always adjust your glove after it has been put on, both of them. Okay. How we doing, Miss Doe?
Doing good.
Just hanging out?
Oh yeah.
Perfect. Perfect. Okay, so the first thing we're going to do is we're going to take our petroleum-based gauze here, and we are going to twist it up. And place it underneath. And without touching the skin, only the dressing, we will create an airtight seal with the petroleum dressing. And then we got two here. We would want to make sure to only grab one gauze pad. So with that one kind of falling off of the sterile field a little bit, that doesn't matter because we are only using one. And in this case, I'm going to come around and work this up over the top of the dressing and place our gauze pad over the top. Okay, so the next thing that we're going to do now is we're going to grab our tape. Using a no-touch technique for the center of the tape. We will place it over the patient's wound. Okay. Make sure to cover up the chest tube completely and create an airtight seal. And after you finish taping, you can remove our gloves, wash our hands, making sure to date, time, and initial our dressing. How does that feel, Miss Doe?
Feels good.
Awesome. Making sure to lower our patient now to a safe and comfortable level while maintaining them in a semi-Fowler's position to assist with the drainage. Unless it's contraindicated, which in this case for Miss Doe it's not, we would start to clean up some of our supplies and again wash our hands, and we would want to make sure to document can put our gown back on here, document the time, date, and assessment findings throughout the dressing change, and unprovide for privacy, and we can go and make those documentations.